Alrick Show.
When last have you checked in on the mental health of a friend, a co-worker, or family member? Maintaining good mental health these days is a very tough one for many, especially during this pandemic. But clinical psychologist Sonia Wynter is here with us today on the Alrick Show. Miss Wynter, how are you doing?
I'm fine. Thanks
Great.
for having me, Alrick.
Yeah, man, I appreciate it. Thank you, because serious times we're living in. Yeah, and help our viewers to understand what is mental health and mental illness, because I think we really need to get to the nitty-gritty of that.
Okay. Mental health is about how does an individual's thoughts and emotions culminate into behaviors that help them to thrive. Behaviors that help them to learn, to take care of themselves physically, to cultivate and maintain healthy relationships, to help them work well and make a meaningful contribution to their community. How does all of those three things, their thoughts, their emotions, and their actions, make sure that they're individuals that are performing at their best? That's the description of mental health.
Right.
Now, you can have be in a healthy state mentally, or you can have certain mental health illnesses. Mental health illnesses take a variety of forms. You can have a mental health disorder, and there's a long list of those. Or you can be just going through a difficult time where you're feeling so overwhelmed that the things that you're doing are not serving you, are not serving your ability to do all of those things I just mentioned. Take care of yourself, to perform really well, to contribute, and to have healthy relationships.
Well, what should we do when we recognize that all these three factors are somehow not necessarily coming together? How do we get help?
It would depend on what it is that you're noticing. So some of the telltale signs that your loved one or your friend or colleague is not doing well or their mental health is suffering is certain changes in their behavior. Their mood might be, up and down, dramatic mood changes. They may be not sleeping well, not eating well. Their personal hygiene might be suffering, a change in personality. They may be more withdrawn, showing signs of pervasive sadness, fear, anxiety. Those are things that tell you that your loved one is having a tough time. Or even things like physical pain that you can't explain through any particular ailment.
Because stress or depression can seriously bring on some physical ailments.
That's correct. A lot of people don't realize that, it's called somatic illness, a pain that you have. But the thing about it is, so it depends on what it is that you're seeing in your loved one. Many situations, you can help just by being there, helping them, talking to them, being around them. Other situations, if they're far more acute, you'll need the help of a professional. Or in some cases, if you're worried that your loved one is thinking about self-harm in any way, that's when you need to probably get them to an accident and emergency wing of a hospital, or get them the immediate help of a psychiatrist.
How do I communicate to someone I love, to a friend or even a stranger, if I should notice that they're not their normal self? How do I talk to them? Because approach is really important as well.
That's true.
Yeah, how do I do that?
That's very true. It's very important to ensure that your loved one does not feel judged, but they feel a sense of empathy
And care and love.
That's correct. And one of the best ways to do that is to say that we're all in a really tough time right now, and you're not yourself. I see that you appear to me to be struggling. You're doing things that I haven't noticed before that seem out of character. And because I know that I myself am struggling, I just want to be there for you. Would you consider doing this? Would you consider coming with me to see this person? So the stigma that surrounds mental health makes this situation and the situation of individuals as well as us as a nation more difficult. Stigma arises most often because we don't understand mental health itself. And oftentimes where there's a lack of education, there are a number of studies that show where there's lack of education, lack of exposure, lack of understanding, then negative attitudes about mental health can arise.
Yeah.
And so individuals can feel judged. They can have a sense of shame around the fact that they're struggling. They can be discriminated against. They can be bullied. They can be ostracized. They can be treated in a way that makes their situation considerably worse, and also prevents them from getting help. That's the number one problem with stigmatization, that, you know, if I reach out for help, somebody else is going to know about my situation, and I'm going to be treated in a way that is embarrassing or causes me shame. Any one of us can have this experience,
Sure.
any one of us. And many people that are suffering with mental health, they've walked a road that's really painful and that has contributed to where they are today. And that the truth is, any one of us, had we walked the same road, would probably be suffering in the same way.
Well, there's some things that we experience from time to time which can really affect our mental health. You know, we might be stressed out about the job, you know,
That's for sure.
depression. You know, how do we help people to understand that, you know, this is where you're inching on,
Yeah.
and how do you, you know, get from that?
Yeah. So as a lot of things that contribute to mental health illness would be, as you mentioned, life experiences.
Right.
You know, things like trauma, abuse, or just tremendous stress. Different experiences that perhaps leave people isolated, a feeling that experiences where people have failed at something,
Yes.
where people have suffered public embarrassment or shame, where people have suffered physical injury and they become debilitated in some way. Pain, chronic pain can affect your mental health, you know, and by that I mean the experience that you're going through is being processed in such a way that your behavior is going to worsen the situation. Your behavior doesn't help to advance your progress or help you to thrive, you know?
More with clinical psychologist Sonia Wynter when we come back.
Alrick Show.
Welcome back to the show. We're talking with clinical psychologist Sonia Wynter, and of course we're now learning more about good mental health and how to preserve ourselves, right? What are some of the coping mechanisms when we can maybe recognize that we're depressed, and stressed, you know, how can we cope?
There are a number of different ways, and I think the approach that you take depends on just how acute your situation is, you know. One of the things about, let's take surviving in this pandemic. A lot of us have been isolated.
Yeah.
Because
isolation can be serious, yeah?
That's correct. And that can bring on feelings of anxiety, that can bring on feelings of depression. In those situations, being able to use whatever avenues and channels to connect with someone else, someone that you love, someone that you feel safe with, that in and of itself can be therapeutic. You know, human beings are the kinds of animals that we're social animals. So we often feel a sense of well-being, and we actually produce hormones that give us a sense of well-being when we feel like we're part of a larger group, such as family, such as friends, such as co-workers. So using any mechanism that helps you to connect quite often can be therapeutic in and of itself. I will say this, one of the interesting things about mental health issues such as depression and anxiety is that you often don't feel like connecting. That's almost one of the symptoms. You want to isolate, you want to withdraw, you know, and to the extent that you can overcome that by actually connecting, that's one of the things that can help. Also, things like introducing a sense of structure to your day.
Yeah.
You know, the thing about being in a workplace is that you have a sense of structure imposed upon you. You have to get up at a certain time, you have to get out of the house at a certain time, you have to get to work at a certain time, and there's a kind of dependability and structure to your daily life, and that can create a sense of meaning and purpose. And when that's lost, such as with this pandemic, where, you know, there's no there's no structure. You know, you can.
We are learning. We're now learning to survive.
That's exactly right. And as a result, you can just feel kind of, you know, like you're wandering around without purpose and so on. So introducing a sense of structure into your day, that helps. You know, trying to get up at the same time, trying to have a dedicated time for work. But those people who are locked in, you know, a lot of people are still going out and they wouldn't experience the same kind of isolation, for instance, you know. If, for example, however, you're experiencing more chronic or what we call clinical symptoms of any of these disorders, you know, then that's when you know that you need to reach out to get help from a professional, from a doctor, from a therapist, from a psychologist, from a psychiatrist.
During this time, is there help online for people?
A lot of psychologists and psychiatrists right now, most of their sessions are actually online and virtual. So if you call their office numbers, they will make arrangements for you to meet with them online. And that helps a lot, you know. It makes meeting your professional a lot less complicated, more convenient, especially when the will to do so is low.
Right.
So that the mere fact that they can come into your space makes it easier.
Are psychologists judgmental?
They can be. I would say psychologists are human beings, just like anyone else. And so every now and then you will find a psychologist or even that will be judgmental, you know. But we try our best not to be. You know, if we are judgmental, then our ability to help is considerably reduced. And I think that most of us understand that. So a sense of acceptance and openness is a very important characteristic or trait for any psychologist to have. And I think I would ask individuals to trust themselves to ensure that they feel comfortable, they feel a sense of safety when speaking to their psychologist. And if they don't, please be flexible, don't give up. Search for somebody else. There's a lot of options out there. That's right.
Now, what are some of the things that we can begin to do outside of, you know, building a schedule for ourselves? What are some of the other things that we can do, even though a lot of us might be locked in? But what are some of the things that we can do probably on the outside so that we can keep that vibe going and to keep ourselves together?
Your physical health is an important part of mental health, and mental health is an important part of physical health. They are both interlocking concepts, you know. So maintaining your physical health through appropriate aerobic activities, very important. That's harder now, you know, not only because many of us are locked in, we can't go out, or the places that we would go, there are a lot of people there, gyms are closed, you know, it's harder.
Right.
That's true. However, to the extent that you can find some way to create an aerobic schedule for yourself, that's very, very, very important as well. May I also say stuff watching your diet. There's a lot going of self-care that's important, you know, but which we now have time for now that we're in this time of pandemic.
More time on our hand. All right, so we take a break. When we come back, we talk about suicide and mental health in children.
Alrick Show.
Welcome back to the show. We're talking about mental health with clinical psychologist Sonia Wynter. We now talk about suicide and mental health in children. You know, a lot of times children, Sonia, we don't pay a lot of attention to their mental health. You know, typical Jamaicans, we tell them, go sit down. Nothing to do. We have to worry about. How dangerous is that?
It has, well, you know, the statistics have shown us how dangerous it can be, you know, because the number of teens who have actually harmed themselves and taken their lives, it has increased over the last several years in Jamaica and globally. Children are going through stressful times just like we are.
As you mentioned self-harm, how can we help individuals who self-harm? What advice do we have for them or strategies to not do it?
That's a difficult one because most often teenagers and young adults who are harming themselves, they often hide it. And so it's not easy to necessarily be aware of what's happening in this child's life.
Right.
However, what I am noticing is that the children and teenagers of today, they seem pretty well educated about mental health. So more and more, they are asking their caregivers to get them help. Unfortunately, not all of them are met with understanding or taken seriously, as you said. You know, and so I think that's what I would urge adults and caregivers, parents, guardians to look out for. If your teenager or child says, I'm having a hard time, Mom, you know, I feel just sad all the time. I feel worthless. I feel like I'm just taking up space. I feel fearful. I feel anxious. I feel like I don't fit in. Those might sound like sort of superficial phrases, but oftentimes there's a lot of deep hurt underneath. If your child ever mentions to you, I'm being bullied, the tagline you'll hear is, I just don't fit in. They don't get me. I don't belong here. I don't feel like I belong.
What do parents do? Because a lot of us parents, we are not equipped to deal with situations like this, because sometimes a lot of parents themselves, they're trying to overcome childhood trauma. That's right? True. How do I deal with this as a father? You know, how does a mother deal with a situation like this?
Again, Alrick, I think the most important thing is to try to not judge. As you opened, you said, you know, quite often the things we hear is what happened to you? Lord, Mrs., you want something wrong with you? You want me to give you something to feel sad about? You know, you don't have no problem. You want me to tell you about problems, etc., and so on. And that shuts down the child. That makes them feel like they themselves are the problem.
True.
You know,
True.
And once I feel that I'm the problem here, that intensifies my feeling of hopelessness.
Well, as you talk about hopelessness, let's talk about the suicide now. Teenagers are doing it. Younger children are doing it. Adults are doing it. What is happening? What is happening to our mental state? How do we get to that point, and how can we even make a shift?
The awareness, and you know, I congratulate you, Alrick. It's programs such as this that will make a difference, that people can understand that we are all struggling here, and these are signs of it. You know, I think that's one of the most important things. A lot of schools are introducing into their curriculum conversations about mental health. That makes a difference as well. You know, there are a lot of programs, even in universities. Those of us who do make it to university, you know, there are programs such as courses about happiness and cultivating happiness and so on.
You know, that program is very interesting to me. You know, happiness. You know, how can you help people to be happy and stay happy? That's
about thriving. You know, the truth is that happiness is a lofty and worthy objective to have.
True.
There are many situations, though, where happiness is not the appropriate response. You know, there are certain situations in life where there are other emotions that are appropriate. You know, if you've lost a loved one and you can't tell somebody to be happy, that they're going to be bereaved. They're going to be filled with grief and sadness. So happiness is something important to strive for, with an understanding that we're designed to feel the full range of emotions.
Right.
You know, fear and anxiety and rejection, even jealousy, all of those are important emotions that we're designed to feel,
and learn how to manage.
Exactly. How we then respond to them is what is an indication of our mental health.
What are some of the signs that I can look for if a child is suicidal or a friend is suicidal? What are some of the things that I can look for without them telling me?
Change, irritability, number one. That one is a little bit hard because, you know, adolescents today, they're going through such a hailstorm of emotion, of hormones that affects their mood. But nonetheless, you have to look out for and make sure you understand what's happening, why they are suddenly their response to something doesn't seem to match what's happening around them. You know, they have a very short week. changes in personality, being withdrawn, just missing all the time, not wanting to interact, not interacting, a lot of screen time that you can't account for as well. You should always, depending on the age of the teenager, have a sense of what is their diet, what are of screen exposure.
Now, what is our role now with mental health, and how can I protect my mental health? Yes. And for our viewers as well. Yeah,
it's important to make sure, I would call it the 3 different domains of who you are, right. Alrick. So, starting with taking care of your physical body.
Right. I need more sleep, Alrick. Alrick, you need more sleep.
That's right. Oh, when you think of taking care of the temple called Alrick, think about sleep, diet, and exercise. Those are the big 3. Right. All right, number 1. And do your best to sustain appropriate practices that will protect those, protect your body.
Where can people go to if they're having, if they need to maintain their mental health, and if they see signs that might interrupt that as well?
Yes. Well, as the important thing in terms of protecting your mental health starts with your body. Mm-hmm. Secondly, it starts with making sure that you're not overloading in any particular domain of your life. So with work, make sure that you have a break, you have ways of relaxing, you have ways of escaping sometimes. You have ways of downtime as well. That's very important, that you have a way of just feeling a sense of well-being somehow.
To filter.
That's right.
How can people contact you?
Okay, we're at Tea House Therapy. Mm-hmm. You can find us in social media, on Instagram, Facebook.
Therapy.
We are Tea House Therapy. Good. We're also at 876-823-5897. Mm-hmm. And you'll also find us, we do have a website as well. It's called SoniaWynterAssociates.com. But Google us, you'll find us. And there are a number of psychologists at Tea House who are compassionate.
And can serve you some tea.
And we serve you tea as well. If tea is your thing, we have tea to help you just relax and just feel like you're not alone in this world and that there's someone who can help.
Thank you so much. All right, you're not alone in this world. There's always someone who can help protect your mental health. I'm Alrick Mackenzie. The Alrick Show will be back next week.
Alrick Show.